On this vote, the yeas are 216, the nays are 211. The bill is passed without objection. The motion to reconsider is laid on the table.
The House cleared a Republican health care package, 216 to 211, that does not extend the expiring Affordable Care Act subsidies. 4 moderate Republicans who had earlier bucked GOP leaders and signed a Democratic-backed discharge petition voted in favor of the health care package. Representative Thomas Massie was the only Republican no vote. The measure now goes to the Senate, where it's unlikely to pass, meaning Congress is set to leave for the holiday recess as millions of Americans will see their healthcare premiums skyrocket. Earlier, House Speaker Mike Johnson denied he had lost control of the House after the GOP moderates revolted and joined Democrats' effort to force a vote on a 3-year extension of the ACA subsidies.
Well, Mike Lawler is a very dear friend and close colleague of mine. And ironically, weekend before last, I was in New York in his district on Long Island, and we were campaigning together, ensuring that he gets reelected. Mike Lawler fights hard for New York, as every Republican in this conference does for their districts. The districts are different. They have different priorities and ideas, but we do have, there's about a dozen members in the conference that are in these swing districts who are fighting hard to make sure that they reduce costs for all of their constituents. And many of them did want to vote on this Obamacare, COVID era subsidy the Democrats created. We looked for a way to try to allow for that pressure release valve, and it just was not to be. We worked on it all the way through the weekend, in fact, and in the end, there was not an agreement, wasn't made. Now, everybody was at the table in good faith, and I certainly appreciate the views and the opinions of every member of this conference. But I will tell you one thing they will all join in unity on is voting for this bill that we've been discussing this morning, because, again, instead of just trying to assist 7% of Americans, this is for 100% of Americans, and we can handle that and do that together. I hope that Democrats will come along with us. If they're serious about solving the problem and bringing down cost of health care, they'll all fully support it as well. But I think you're going to see they're playing politics with this.
Moderate Republicans who signed on to the petition took aim at House leadership. The Republican-controlled House will hold a vote on a clean 3-year extension of the ACA subsidies. However, the vote is not expected to occur until January 2026 at the earliest, given the rules for when a discharge petition can hit the floor. The big question now is how the Senate will respond. The Senate already rejected a clean 3-year extension of the subsidies in a pair of dueling healthcare votes last week.
For 15 long years, Americans have now faced skyrocketing premiums, fewer quality choices, inefficient care, and widespread fraud, waste, and abuse. Benchmark premiums on the Obamacare marketplace for every plan, listen to this, they've increased 80% overall since 2014, and they're continuing to rise. The Unaffordable Care Act marketplace has resulted in lower quality plan offerings and less consumer choices to date. Fraud is absolutely rampant. Paragon Health is one of the analyst groups, and they estimate there's over 6.4 million people who are improperly enrolled in the Obamacare exchanges. And a recent GAO study, the Government Accountability Office, found some staggering facts. It proved what we all know intuitively about the fraud that's involved in this program. They found that Obamacare's subsidy system lacks even the most basic guardrails to prevent fraud, waste, and abuse. And I think that study is something that you should all dig into. It should be on the front page of every newspaper because it is shocking and alarming. Over the last 2 years, for example, the investigators at the GAO, Government Accountability Office, they did a little experiment. They in 24 different cases, they applied for Obamacare subsidies. They did it fraudulently by intent. So 24 applications with no Social Security data attached, none of the information that's necessary to actually apply, no citizenship proof attached, and none of the income documents and all the things that are supposed to be applied and included in an application. Now, guess what? Out of the 24, 23 of them were approved. And they've been paid tens of thousands of dollars, some of them as recently as September of this year, the GAO tracking all of this fraud, wondering, hoping if anybody will ever pay any attention to it and stop it. That's not the only thing they found. The report also found that in 2023, 29,000 Social Security numbers were used by multiple persons. In 2024, 68,000 Social Security numbers used by multiple people to bilk the system, to defraud the system, and to take dollars to themselves. You had, in one case, there was over 120 individuals using the same Social Security number to get these benefits, and it was never stopped. The GAO also found that more than $94 million last year alone was sent to insurers on behalf of people who were already deceased. It's a serious, serious problem in the system. It's why the costs are so high, and this is the system that Democrats in Congress want to extend without any reform. We just can't have that. The Washington Post summarized all this best in one simple sentence. They said, quote, "The real problem is that the Affordable Care Act was never actually affordable." That's the problem. America's healthcare system should be the envy of the world. Instead, it's the most expensive in the world, and the American people are not getting any healthier because of all this madness. A new Gallup poll released yesterday found that 70% of Americans have a negative outlook on our healthcare system for all the obvious reasons. All Americans deserve a healthcare system that puts patients first, one that meets their needs with more access, more choice, and more affordable quality care. And House Republicans have offered legislation to begin fixing what is broken and to restore integrity to our nation's healthcare system. And it's so long overdue. The Lower Healthcare Premiums for All Americans Act, which will be on the floor tomorrow, is the first big step in that regard. As has been noted by Dr. Miller Meeks and the other leaders here, it offers common sense solutions to lower premium cost for everybody, all Americans. It expands access to quality care, provides every American with more options and flexibility to choose coverage that works for them, and it brings greater transparency to America's healthcare system. And here's how. The bill has 5 key reforms. I'll just reiterate some of this real quickly. It reduces premium costs through cost-sharing reduction payments. It brings pharmacy benefit manager transparency and removes the hidden cost of prescription drugs. It allows small business owners and independent workers to form association health plans. It provides more choice for employees to customize their health care plans, and it protects small businesses from costly regulatory overreach. According to the latest CBO projection, Republicans' cost-sharing reduction payments, just that provision alone, would reduce premiums by at least 11% and will save taxpayers tens of billions of dollars, about $30 billion. Contrast this with the Democrats' proposal. Now, what is their proposal? The Democrats' subsidy proposal would only lower premiums for a small subset of people. Now, think of this. Just 7% of Americans would benefit. When they passed the COVID-era enhanced subsidy, enhanced premium tax credit, okay, it would only affect, and only did affect, 7% of the American people. If it was extended today, if their gambit was done and without any reforms, and they expanded it for 3 years, which is what they tried to do in the Senate, and they failed last week, and what they would try to do in the House, if allowed, that would only reduce, for the 7% of Americans, it would only reduce their cost by 5.7%.